What is a varicocele? It's basically like a varicose vein. I'm sure all of you have heard the term like spider veins. And when you get older, you can like start to see your veins in your legs and your lower limbs. That's basically what a varicocele is, but it's happening in the scrotum. So in the pouch of skin that holds the testicles. And when those veins become enlarged, they swell, they can become twisted, and it causes blood to pool. And we have to kind of consider this sort of like a plumbing issue, right? The tubes where the blood flows in and around the testicles and in the scrotum is getting backed up. And this is going to cause a problem for a variety of reasons that we'll get into in just a second. Varicoceles are actually one of the most common causes of male factor infertility. And yet we're not assessing them across the board, even in men who have suboptimal numbers, meaning they're not terrible, but they're not good, and we're missing things. So 15% of all men, infertile or fertile, actually have varicoceles, and around 40% of men who have been labeled as infertile have a varicocele. That's nearly half. That's a big number. So if you are having numbers that aren't looking optimal on your semen analysis, but you haven't been assessed for a varicocele, we're missing a big potential root cause piece that, by the way, is treatable and fixable. So we really need to make sure that we're advocating for this as a potential diagnosis, and not just if your semen analysis is deemed abnormal, but even if it's below optimal. And again, we get into that inside his confidence and of course, fertility confidence method as well. The annoying part with varicoceles is men might not have any symptoms. So I get asked this question quite a bit of like, well, okay, if this is going on, like, how do we know? And the only way to know truly is to do physical exam. However, some men, depending on the size and severity of the varicocele, may feel a sort of dull, aching sensation in their scrotum, particularly that gets worse after standing for long periods of time, because obviously gravity or physical activity. It might feel heavy in the scrotum. And I would say, I mean, obviously I don't have a scrotum, so I don't know for sure. Maybe I should ask Tyler this question. And if he hears this when he's recording, he might die that I'm talking about his scrotum, but it's okay. We're all friends here, right? I'm sure in men, and men, you can DM me and correct me. I'm sure there's some degree of like physical sensation with standing for too long or with prolonged heat exposure. So this isn't just like a one-off kind of symptom. This is something that you're experiencing, maybe not daily, but pretty darn close to. You might also be able to actually feel the enlarged vein in school when we're learning. So when I was in naturopathic medical college, we learned all around doing physical exams for both men and women. I'm trained to do pap tests. I was trained to assess prostates. This is not something I ever used in practice, but we learned it. And so one of the things was to actually feel and palpate for enlarged veins in the scrotum. And they say it kind of feels like a bag of worms because normally you don't really feel those veins, like maybe a little bit, but these are obviously thicker because they're dilated. That's what a varicose vein is. So doing self-exams, you can monitor like that feels different, right? And if it feels different, we should be assessing. It also can actually shrink the testicle because if we're impacting blood flow, it's going to impact the organ. So that's another thing to kind of think about. So if your partner's ever complaining of any weird sensations, it's honest to goodness, even if their semen analysis is fine, it's still worthwhile to just get checked, right? And make sure that everything is okay.